Good morning, everybody. Thanks for coming back today. As Dr. Levy said, I'm going to start out by giving you an overview of what daily rounds is, sort of from the academic standpoint, and why we recommend doing daily rounds, and exactly what that entails. And then we'll have Dr. Jax come up, and she's a real live shelter veterinarian, so she'll be able to tell you how does that work in practice a little bit better than I may be able to. So before I start, I'd also like to thank PetSmart Charities for sponsoring this session. They do a lot for us at University of Florida, as well as for shelter medicine in general, so we're grateful for their support today. All right, so a couple objectives for this presentation. As I said, we want to understand the role of daily rounds in a proactive population management plan, and that's the key word, and you'll see that come up a few times during my slides, is that this really is a proactive thing. So animal control organizations, animal sheltering organizations traditionally are very reactive, and so we want to try to change that so that we can save more lives, and the way to do that is by being proactive in the way that we manage the animals in our care. What we're going to do is tell you how to create a daily rounds team, who should be on that team, and how you can integrate its function into the daily operation of your shelter. And then we'll discuss some practical tips and techniques for actually making it work. So to start out, we'll talk a little bit about what population management is and what I mean when I say that. And so one definition is population management is the use of evidence-based decision-making to influence the flow of animals through the shelter. So again, that's a very proactive thing. The evidence-based portion of it that I'm talking about is the information that you're going to collect when you're doing daily rounds and you're actively managing the population in the shelter. And then notice you're going to influence the flow. It's not just something that's going to happen on its own. You actually play an active role in that. And the goals of a population management plan are to enhance the physical and mental well-being of each and every animal that's in the shelter, as well as to increase the life-saving capacity of the shelter as a whole. And so how do daily rounds fit into a population management plan? So Dr. Levy talked about the Association of Shelter Veterinarians Guidelines for Standards of Care, which hopefully everybody has seen. And there is actually a population management section in there. And they've split that population management section into two components. So one is the monitoring of statistical data. And they talk about the importance of measuring monthly intake and the monthly outcome of animals, figuring out where they're coming from, where they're going, and keeping track of that information. And then the second component of population management is maintaining capacity for care. And so I've split that up into three different areas. And the first being intake diversion. And we'll talk a little bit about each of these, and then obviously a little bit more time on daily rounds. The second being daily rounds, and then the third being pathway planning. So we'll start by intake diversion because this is, as it says, a proactive approach to actually reducing intake. So let's start at the beginning. And I've listed just a couple of ways that many shelters have found to be successful ways of proactively diverting intake away from the shelter. So finding an animal's placement or some other option before they actually arrive at the shelter. And so closing night drop boxes, offering behavior counseling. We know that behavioral problems are the number one reason that animals enter shelters. So maybe we can do something about that before they get there. Encouraging owners to rehome animals themselves is an option that many shelters are successful with. How about transferring puppies and kittens to foster homes? So as soon as they come in, or maybe even before they come into the shelter, you have a foster home lined up that's ready to take those puppies and kittens so they never have to come in and go through the shelter system. You can restrict or schedule owner relinquishment. Even for the open admission municipal shelters, very few, if you actually really scrutinize the legal code, very few of you really have to take in owner relinquished animals. Of course, that's a great service that we want to offer the public. But if you're faced with a disease outbreak or severe crowding in your shelter, you might want to consider restricting owner relinquishment for a period of time, if not stopping it altogether, or scheduling it for a time when you can better take care of the animals that are coming in. And then one of our favorite ones at UF is trap, neuter, return for feral cats. So intake diversion is a way of proactively managing animals when they come into the shelter. Pathway planning is a proactive approach to animal disposition. So this is the idea that you're going to identify the likely outcome for that animal and ensure it gets there as quickly as possible. And so you know in your organization when an animal comes in what the most likely outcome for that animal is going to be most of the time. So if you have a cat that comes in with a collar and a tag, that's a pretty rare event, right? So you know that there's a good chance you're going to be able to find a home for that or find the owner of that animal. It's probably a lost pet. And so you're going to set that animal on a pathway for tracking down that lost owner. Another example might be a purebred puppy that comes in. Say it's a purebred dachshund, and you know you have a really great dachshund rescue group in the area. And so the pathway planning for that animal is going to be to get it to dachshund rescue as soon as possible. And so basically you have a good idea of what's going to happen when the animal comes in, so let's start getting it on that pathway and get it there as soon as possible. And this is important because we're going to define this pathway when the animal comes into the shelter, but we're going to review this pathway during daily rounds. So it doesn't have to stay on that pathway what you put it on. It's just something that you have to keep in the back of your mind when you're managing the population to get the animal to its outcome as efficiently as possible. So just a couple examples of pathway planning. Here are the 4 basic ways that most animals leave our sheltering organizations. So return to owner, obviously that's ideal and our number 1 way of getting them out. Ways that you can ensure that that happens efficiently and effectively is to have proper microchip scanning. So obviously the picture here, probably not the best way to scan the animal for a chip. It does actually work, but... And then lost and found. So making sure you have a lost and found book that's kept up to date. You have somebody that's going through that, trying to match up lost animals with the strays that are coming into your facility. Animals on a pathway to adoption. So a couple options that we use are fast-track adoptions. And that's the idea that you have an animal that you know is super adoptable, really cute little kitten. And so what you're going to do is get it through the system as quickly as possible. Move it to the front of the line for spay-neuter. Move it to the front of the line for your felinality or whatever other procedures that need to happen to that kitten before it gets adopted. This way it can get out on the adoption floor and get into its home as quickly as possible without having to wait for all the other animals that may have actually came in before it. Open selection is another method of pathway planning for adoptable animals. And so this is the idea that instead of us as workers in the shelter having to choose which animals go up for adoption, let the public choose. So open the shelter up to open the stray holding areas up to the public. Let them walk through and decide which animals they want so they can select the animals for adoption themselves. And obviously there's stray holding periods, so they may not be able to take that animal home right away, but they can put their name on a list, and then when that animal's holding period is up, it's automatically ready to go and you have a home lined up. Transfer is another way that animals leave the shelter. So we want to make sure that we've set up means for that to happen quickly and as efficiently as possible. So there are some organizations that we've worked with that have set up programs where if they get a litter of puppies or kittens that come into the shelter, they'll stay in the lobby of the shelter, and then the rescue group will come and take them directly from the lobby. Or better yet, the animal control officer who picks up a litter of puppies or kittens will deliver them directly to a different organization that's ready and willing and able to take care of them. So a couple examples there. And then euthanasia, unfortunately, is another way that animals tend to leave our facilities. And so you want to be sure that you have people that are trained and scheduled to perform euthanasia when it's necessary. And so it's especially important when you have animals relinquished by an owner for euthanasia. You don't want to have them waiting in the shelter for that to happen. You want to get that done as efficiently as possible. So that brings us to daily rounds, which we talked about, proactive approach to intake, proactive approach to outcome. Daily rounds is a proactive approach to in-shelter care. And so this has distinct functions from veterinary and facility rounds, and I've underlined functions there because it may actually happen at the same time, depending on your organization. So when I say veterinary rounds, I'm talking about the veterinarian going around or the veterinary staff going around monitoring animals that are sick or that are under medical treatment and updating their progress. Facility rounds might be when people go around the shelter and make an assessment of the general building. Are there guillotine doors that are broken that need to be fixed? Are the aisleways clear of clutter? Is it safe for people to walk through? And that's different from daily rounds that we're talking about here. You can call it whatever you want. I think they call it population rounds at Jacksonville, and Dr. Jacks can talk to you about that. But the point is that there's a specific function. So the function of the daily rounds we're talking about is to manage the population. And so it means we're going to identify problems with the animals that are in our care, identify any holdups that are preventing them from getting to their outcome as quickly as possible. And so Goals, we want to identify their needs, both physical and behavioral. We want to create a response plan, and we want to ensure accountability to make sure that response plan gets carried out. So why do we need them? Again, we have the guidelines here that I put a picture of up on the slide, and so it's become a best practice to perform daily rounds. And so this appears multiple times in the guidelines, two times are in the population management section, as I mentioned before. And so it says, inspection of all animals must be performed daily in order to routinely evaluate and monitor adequacy of capacity and to identify needs. And it appears again in the medical health and physical well-being section. Rounds must be conducted at least once every 24 hours by a trained individual in order to visually observe and monitor the health and well-being of every animal. And that's really one of the reasons why a veterinarian needs to be involved in this process as well, because they are specifically trained to recognize illness in animals. So, who else is involved? So we have a team of staff members that we want to see doing daily rounds, and the first person we want to identify is a population manager. So they may have some other role in the shelter, but they are going to be one person who's designated to be the population manager. And they're going to be in charge of maintaining the list that we'll talk about and show you of all the animals and what their needs are that are identified during daily rounds. You want to have a member of the operations management team on this daily rounds team as well. These are the people that are going to ensure that tasks get completed. They're usually the ones responsible for the daily husbandry of the animals and daily monitoring that happens. So you want to be sure that they're in the loop and they have some decision-making capabilities as well. Of course, you want a member of the veterinary staff, which we'll talk more about. They're going to be the ones who are trained to identify the medical and behavioral needs of the animals in care and can offer some advice and support for how you can manage the animals as you identify needs along your daily rounds walkthroughs. And then it's always a good idea to have a member of the executive management team perform daily rounds with you. And so frequently these individuals are very busy running the shelter and don't actually get time to get on the floor and see what's actually going on in their facility. And so we recommend that at minimum they participate in daily rounds once a week. So what exactly does this group of people do? So they walk through the shelter, physically walk through the shelter. That's really important. A lot of places will work with shelters and they have an idea in their head that they're performing daily rounds by looking at the printout of an inventory and going through their head what's in the kennel or looking at what's online. You have to actually walk through the shelter each day and evaluate each and every animal. And so these are the 5 questions that we want you to ask in your mind as you're going through and looking at each individual. First of all, who are you? So does this animal have identification? Is it the correct identification? Does the description on the cage card match the animal that's in the cage? How are you? So how is the animal medically? How is the animal behaviorally? Are you where you should be? So is this a sick animal that's mixed in with the general population that we need to identify a different space for him to live? Is it a neonatal kitten in with a bunch of adult cats that have specific infectious disease risks? We need to know those things and identify them. And then, do you need something today? So this is where the action part comes in. So we've looked at these animals and we've seen that they're in the shelter, they have their ID, they're in the right place. So then you want to ask yourself, what's the holdup? What's preventing this animal from getting out of the facility today? So does this animal need spay and neuter? Does it need a behavior evaluation? Whatever it might be, you want to be sure that you can identify that. And then do you need something to be scheduled? Maybe the animal's holding period is up tomorrow, so we can schedule its spay-neuter surgery for the following day. So you want to get a handle on that ahead of time and not wait until that period has already passed. So some more specifics about what you want to actually monitor. And again, so these things may be occurring at separate times. Monitoring of these things may occur during multiple different types of rounds. I mentioned veterinary rounds or facility rounds. You can do animal husbandry rounds. These is where the people who are feeding and cleaning the animals are actually taking account of whether or not animals are eating, if there's any problems with urination or defecation, because they're often the first ones who are going to notice problems, so they have to have a way of communicating that as well. And so they may have communicated that to the daily rounds team, and then when the daily rounds team goes around, they may be able to follow up on those items. So if that hasn't happened separately, you're going to have to monitor these things as well. So food and water consumption, urination, defecation, attitude and behavior, ambulation and signs of illness and pain are also important ones that are frequently forgotten. So we'll play this video clip here of an animal that I saw when I was walking through a shelter. This is an older lab that was relinquished by its owner a day or two before I took this video. So what do you guys think? Is this animal comfortable? Is he probably uncomfortable, not able to ambulate very well, right? Maybe in pain. Did anybody notice anything? Yeah, so if you didn't notice, his claws are quite overgrown. This is a dog, like I said, had been in the shelter for a couple of days, and nobody had noticed that. That was the reason that he's having so much difficulty, or at least one of the reasons. So these are the kind of things that you should pick up on your daily rounds walkthrough, and why it's important to actually physically walk through the kennel and look at the animals and observe them for a couple of seconds just to see, to catch things like this. So then we'll go through a couple of picture slides here. Some of them are a little bit subtle and a little bit difficult, and I did that on purpose because I want, this is an advanced and more advanced group, and I want to point out the fact that there are some things that may look normal to some people and may take a little bit of extra training and a really keen eye to pick up that something may not be quite right. Even though you don't know what it is, that's okay. The point of the daily rounds is just to identify that a problem exists and to set up a plan for following up on that problem. So what do people think about the photo on the left with the two cats? Good, so I heard there's diarrhea or vomit running down the cage. So we had a cat on the top that was sick, and the cat on the bottom that was healthy, probably not going to be healthy for much longer, right? So here's an example of where you needed to identify this. There's a sick cat in the population with healthy animals, and so he may need treatment, may need additional medical care, but the point is we have to identify that and then have a way of following up on that. So that's what daily rounds can do. How about the cat on the top right? Here he's got a litter box issue. What's the issue? Yeah, it's too small. It's not appropriate for the size of that cat. That's a big cat. He can't get in and out of that box. It's falling apart. And so it's not meeting his behavioral needs to eliminate in a clean environment. How about the cat on the bottom right? He's not spraying. That's a good, yeah, it does look like that though. He can't hold his tail up, I heard in the back. Yeah, so is this cage appropriate for this cat to be living in? No, it's very uncomfortable. So he can't even move around normally in this environment. So you would have to identify a different place for him to go when you saw this. How about this? Does this look abnormal to anybody? There's food, there's water up at the front of the cage, sorry, but that's a good point. Yeah, so that's a good observation. I heard somebody say he's curled up like he doesn't feel well. So I'll tell you that this is a dog. You may actually recognize him because you saw him yesterday in somebody else's presentation. But this is a dog in a shelter in South Florida in late spring. So it's not cold. You might think he's cold. He's kind of curled up on his bed. Other dogs at the front of the cage around him barking, acting normally. So I walked by and I saw this. So I thought something was not right. So I looked a little closer. You guys see the nasal discharge coming out of this dog. And so you may remember from Dr. Crawford's presentation, this is a dog that had Streptococcus zoepidemicus. I think he was actually co-infected with distemper as well, if I remember correctly. So definitely something that you need to pick up as you're walking through the shelter and take notice of. And so that might be subtle because the only thing that caught my eye was this dog was laying there, just didn't look right for the rest of the environment that was going on. So how about the cat on the top left? It's a Happy, comfortable cat? Stressed cat? See some head nods, so it's a stressed cat. Does anybody have any guesses as to why this cat is stressed? What was that? No hiding box. That might help. I'll show you the whole picture. All right. So again, it becomes pretty obvious when you walk through, why is this cat not coping well in the shelter? It's being housed next to a dog. So you guys probably all know that that's probably the number one stressor for cats, is being co-housed or housed near or within visual or auditory distance of strange dogs that they're not familiar with. How about the dog on the right? No, he's just mid-bark. There was a comment that maybe there was something wrong with his mouth. But this one might be a little bit tricky. So remember the 5 questions I put up before? Who is this dog? Can anybody tell? There's no cage card, no number on the cage, no ID on the dog, so there's no way of figuring out which animal this actually is. And if I showed you the full picture, there were 3 or 4 dogs that looked pretty similar to him in this bank of runs. None of them had any ID, so there probably is somebody running around the shelter who knows in their head which dog this is, but that doesn't help other staff members and medical team that may need to come in and perform treatments on specific animals. How about this cat? So I heard a couple people say he was sick, or she rather. She might be, so they have a couple of treats that are sitting up on the ledge there, and I can tell you I put those there a few hours before this picture was taken. And so this cat was not eating. And how about for the veterinarians in the room, do you have any particular concerns about this cat not eating? Yes, I think I heard hepatic lipidosis. So whenever you have an overweight cat that suddenly stops eating, they're at risk for severe liver problems. And so that's a huge concern that you may not notice if you're not walking through the shelter, looking through the animals, and keeping track of whether or not they're eating. This is a tricky one also. What do people see here? Potbelly, I heard. All right, so that's the key observation. So what do you think most people might think when they walk through here? Pregnant, okay. What if I told you it's a male? I hear it. So this is a dog that is in right heart failure from heartworm disease. So there's fluid building up in his belly. So again, another important reason why you may need actually veterinary eyes on this particular patient to determine that that's a medical problem and not just a dog with worms or with or pregnant if it was a female. What's going on here? All right, good. I'm hearing lots of things. So no food, no water, no bedding. Yeah, so I heard somebody had the key observation here is that this one puppy is out by himself. And that's a red flag for a lot of veterinarians in the room when you have a litter of kittens or puppies and there's one that's just off to the side. Frequently that's one that is ill. And so in this case, this is a puppy that had diarrhea. I don't know what the cause was, but just noticed that this was happening. So it's a way of keying in on a sick puppy that might need a little bit extra care. And so a plan has to be developed to take care of this animal. So this is the last one, maybe a little tricky one too. So what do you guys see wrong with this picture? Salivating. Okay, so veterinarians or veterinary staff, what do you think about that when you see a salivating cat? I heard something caught in the mouth. I heard calicivirus. Dental disease. Okay, there's one other. So if we actually looked in this cat's mouth, we would see that it had some ulcers on its tongue. And so calicivirus would be one thing that you'd be concerned about. And the other thing is that toxicity from quaternary ammonium cleaners can cause that too, so good. And so I purposely did not show you the ulcers in the mouth because you wouldn't see that when you're just walking through the shelter. All you're going to see is this. And so you need somebody who recognizes, hey, this is a problem. We need to investigate this a little bit more. All right, so just a couple of special considerations and special points when you're doing these walkthroughs. You want to have somebody, again, this may not be the daily rounds team, it may be the actual animal husbandry person who's cleaning and feeding, that are filling out a check sheet to say whether or not an animal ate, whether it urinated and defecated normally, and then the daily rounds team comes at a later time and actually monitors that check sheet and follows up on items that are on there. But some type of monitoring has to occur before cleaning and feeding, and this picture provides a good example why. So look at all the information that we would not have if this cage had been cleaned and the animal had been fed. There's diarrhea in the cage, the food bowl is full of food, he has not eaten. The water is discolored. I'm not sure if you can appreciate that on the projector, but it's a little bit yellow-colored water, so there was actually disinfectant in the water, so the dog didn't have a clean water supply. So all these things you would not have noticed if you had come around later and then decided to observe the dog at a later point. Other important practical point is that if you have group-housed animals, somebody has to be monitoring them during feeding. So obviously it's important for assessing appetite, because you're not going to know if there's 2 or more animals in a cage, which one ate the food if you come back later. And then also to note some conflicts. And then I have a video clip here that'll demonstrate the importance of monitoring during feeding if you're forced to group house animals. So the staff member did what they thought they were doing right. They put 2 food bowls down, they separated them at different ends of the run, but there were so many other animals to take care of that they didn't have time to stand there and watch like I did. So these dogs were housed together for at least a couple of days when this video was taken. And so we don't know if that black and white dog had anything to eat in the last 2 or 3 days. And so that's one other reason that there's a handout in the appendix to the notes to this section that talks about conquering crowding. And so that's one of the daily rounds is one way of unwinding crowding if you're facing that in your shelter. And so that relieves the problem that I just mentioned, that this person didn't have time because there were so many other animals to take care of. They didn't have time to stand there and watch to make sure everybody was eating. And so if you are instituting an active daily rounds program, it's one of the tools that you can use to unwind that crowding so that you do have time to take care of the animals like they need to be. And so just a couple words on actually getting things done. So here's an example, and you have a copy of this sheet in your notes as well, of a sample daily rounds form that you might use. So you're going to record the date, the animal's ID number, the kennel number, and what's the action that you want to be taken that day on the animal, any specific notes. You might have to have an explanation there. Why is this animal not at its outcome yet? The goal is to get them through the system as quickly as possible, so you want to know what's the holdup. And then you can make an action item. You can request it. You'll know who requested it. And then you have a slot for whether or not it was completed and when it was completed. And so the benefit of writing this down is that you can look at this data and go back and identify what are the obstacles to animal flow. So are we finding that animals are frequently waiting for spay-neuter, and that's what the holdup is? Are they frequently waiting for behavior evaluation? Are they getting sick in the shelter, and that's what's taking them so long to get to their outcome? And you can go back and evaluate this information and then take steps to correct that so you can move them through more quickly. And then it allows for open communication. So it's written down. Everybody knows what's supposed to happen, who's supposed to do it, and you can ensure that it actually does occur. So with that, we will switch over to Dr. Jackson. She'll give you some information about how she instituted daily rounds at Jacksonville Animal Care and Protective Services.